Authentic Wellness with Joni and Joey. I'm Joni.
And I'm Joey.
First episode.
It's here. We are official now.
This is going to be so good. I want you guys to get to know us a little bit. I'm Joni. I've been married to my husband for 30 years. I have 3 adult children. I'm an entrepreneur. Have owned my own businesses for my entire adult life. But health and wellness has always been kind of my side hustle. I've always tried to figure out ways to stay healthy. At first it was kind of just to keep in shape, but then it was to make myself feel good and make sure that I had enough of me to be able to give to others, to be able to give to my family and my career and my staff that works for me. I'm a type A, total type A personality too. So that's a little bit about me. Joey?
I'm Joey, and I am the complete polar opposite of whatever type A is, because that's not me. What we have discovered in our time together is that we have a lot of things in common, but we are very different in so many ways. She's told you about her 30-year marriage and her 3 grown kids and all of the stuff that goes along with Joni. Well, I'm a divorced mom with school-age kids, so I'm still running kids back and forth to practices and 2 different schools and all of the things that go along with that. I was a menopause baby. If you don't know what that is, it means that my parents had me very late in their life. So when I had a toddler and a newborn, I had 2 parents that were steadily declining in health as well. So I think they called it the sandwich generation, and that's exactly what it is. You're getting pressed from all sides. So where Joni has been awesome at finding ways to take care of herself, I waited until I got to the absolute bottom of my cup, so to speak, and had to find ways to try to climb out. So we've come about health and wellness from different areas, but what we're finding is that journey is taking us on some of the same places, which is
that's the cool thing, is that our backgrounds are different, but our path to wellness is the same.
Right.
We have found so many of the same things that work for us.
We found a lot that didn't work too.
True.
To be honest.
True.
But we found a lot of the same things, and now we have this beautiful platform to help bring some of those resources to a broader audience and share some of our experiences.
Yes, and one of the things that we always talk about is balance.
Right.
How do you know if you're in balance? And for me personally, when I'm in balance, I can feel it. I feel good. I wake up energized. I know what my day is going to be like. Everything goes right. Let's say you get that parking spot when you're looking for it at the store. The boss says yes, or just everything seems to be going your way. It's flowing.
Right.
And then when I'm not in balance, when something is not right, I'm snippy, or I'm short-tempered, or I snap at my husband, or things just don't seem to be going my way, and I have to kind of take a step back and look at it why is that happening? What's going on?
Right. And that's the thing that we've learned, is it's such an individual process. What works for one person may not work for another person. I definitely know I feel when I'm out of balance. When I'm in balance, I'm oh, this is awesome. I don't know what this is, but I like it. So again, we go about things a little differently.
Well, part of it is being aware of that too.
It is.
Knowing yourself and being aware, noticing.
Yeah. So we're so excited to be able to come to you and share some of the resources, bring in guests, because our goal is that we continue to learn right along with you. We're not experts in any way.
We'll bring the experts in.
We'll bring the experts in, exactly. Yeah. And our hope is that we all continue to grow and learn and get better together. And the one we're starting with is pretty fantastic.
I think so.
Yeah, I'll give Joni credit for this, because when she said, I think we should bring in a functional medicine physician, I'm okay, what is that?
She really did say that.
Yeah. I guess sounds good.
So my interpretation of functional medicine is, so let's compare it to medicine, or a regular doctor, MD. You go to a doctor when something's wrong.
Right.
And more times than not, the doctor will give you a prescription, and that will mask your symptoms or make you feel better. But is the problem gone?
Right.
Maybe not.
Maybe
right?
not.
So functional medicine, they, on the other hand, will try to find the root cause to the issue, and they'll try to treat that so that the whole problem will go away.
Which makes so much more sense.
I love that idea.
Yeah, I do too. I think that's wonderful, and I think I've shared with you when my parents first started to have their health decline. My dad was he was having trouble breathing, like to a point where it was impacting his life substantially. And so his primary care doctor sent him to a pulmonologist. They ran all the tests on his lungs, and it came back, didn't find anything. Well, it's not in your lungs. Good luck. Thanks. See you later.
So where do you go from there?
Exactly. So, and we bounced from specialty to specialty trying to figure out what was causing this. And I think back to that time, and I'm like, if there had only been a functional medicine person or someone who would look at my dad as a whole person and say, this guy's having a hard time breathing, we need to figure out why. That would have been so incredible.
Right.
Yeah.
Right. And there's so many issues that people have that functional medicine could probably address.
Right. So we're lucky enough to have not only someone that you have personal experience with, but someone that's in our hometown that we're going to go visit here shortly and talk with her about functional medicine. So tell us a little bit about Dr. Amy Ingram.
Yes, so Dr. Amy Ingram is the founder and owner of Family Functional Medicine on Elm Street in Greensboro. And I'm going to read her bio to you. So Dr. Ingram received her undergraduate degree in biology from North Carolina State University. She received her medical degree from the Brody School of Medicine at East Carolina University. And then she started her career in family practice and obstetrics. And then I think she started to feel like what we're saying, like she was tired of writing prescriptions to take care of issues. She wanted to get to the root causes of things. So she started her coursework at the American College for Advancement in Medicine, the Institute of Functional Medicine, North Carolina Integrative Medicine Society, and the Cleveland Clinic. And then she ended up in functional medicine.
How about that? Those are some pretty strong credentials.
Right, impressive.
That's very impressive. So let's go talk to her. Let's go see what she has to say, and we'll be right back with you.
Here we are at Family Functional Medicine with Dr. Ingram.
Our first official guest. Oh
Yes. Thank you so much for joining us.
Oh, I'm honored. Thank
We're
you.
so excited to be here. We have so many questions about functional medicine.
Yes, and about you and how you got into functional medicine and how our viewers can find out more about functional medicine and how they can find their very own Amy Ingram where they live.
Awesome.
As Joni and I have talked, we're professional women, we're moms, we've kind of been on this journey to wellness to figure out things that we can do to take care of ourselves so that we can stay in balance. And Dr. Ingram is the same way. Professional woman, mom, has worked on her medical career and has moved into functional medicine. I'm sure that was a journey that kind of unfolded in front of you as you were going along. We'd love to hear your story and kind of how you got here.
Yes.
Great, thanks. Yeah, and just as people are on a wellness journey, my medical education has been a journey. I went to conventional medical school and went into practice and realized that I wasn't really helping people become healthy as much as I wanted them to.
How much time did you spend in regular practice?
I spent 8 years in practice.
Okay.
And then I took a sabbatical with my children, because I have 2 children, and one of my children had some behavioral and health issues. So that's really what got me started on this journey. We had the typical standard American diet, and I realized to help his behavior, we needed to make some changes in our diet, in all of our diet. You can't do that overnight.
Right.
So it was slowly making some changes, and where we are now is really pretty healthy, and thank goodness behavior is becoming better, and we're using other tools to help control behavior as well. So that's how my journey started. And then I was very fortunate to be in Greensboro working with an integrative medical physician and learning from her. She was a pioneer in this area.
So can I ask what that means? What does an integrative physician mean?
Yeah, so there's a lot of overlap between integrative and functional and naturopathic and chiropractic.
Okay.
And we can talk a little bit more about what functional medicine fits into all of that. But again, it's all very holistic and looking at the body as a whole. So I was learning a lot from this physician, and then started becoming sick myself, but didn't realize it. So what had happened is this building had mold, and I had been working this building for 2 years, and I was starting to have brain fog and anxiety and breathing problems, and no one really knew what was going on until we had a patient come in the office who had had mold exposure and told the physician, "You have mold in here." So that day we had it tested. The next day we shut down. The building shut down, was condemned. And we actually had 3 kinds of mold. We had Stachybotrys, which is what they call the toxic black mold, the really bad one. We had Chetomian, which is related to cancer. And then the doctor I worked with went on to have breast cancer. And then we had another one, Aspergillus. So that started me on another journey to heal myself from mold.
So when you heard all of that, did a light bulb just go off and you're just like, I think that's what's wrong with me?
Yes.
That you had mold exposure?
Yeah, it finally all came together.
Wow.
That, here we are, we're treating people, and I'm like, oh, this is why I'm so sick. Because I didn't really realize I was sick.
Right. But I'm sure, you're working in a physician's office, so I'm sure it wasn't like black mold on the walls. It wasn't something that was obvious when you walked in that this building could possibly be making you sick.
Right, and that's one of the things about mold. It's kind of sneaky. We had some spots on the ceiling, and now retrospectively, the nurse that was on the other side of the contaminated wall, she was also slowly becoming very sick.
Oh my goodness.
And she also had to quit working. And
Interesting.
So a lot of this was my journey for education was about healing my son and about healing myself, but realizing that there are so many people out there that are suffering and don't know it. Mm-hmm. I could finally, like you said, put it together. Oh, mold, and I don't feel right. But there are so many people who can't ever make that connection, and they go to conventional doctors. And in medical school, we were taught mold is just an allergy. It makes you sneeze. All those symptoms are not real. Mm-hmm. But they really are. And the other thing with mold is not everybody is affected by it. About 1 in 4 people are affected.
Oh,
so you can have, even in a house, you can have 4 people, but only 1 or 2 of them are sick.
Wow.
So after discovering this and figuring out how to treat yourself, is that when you decided this is how I want to help other people?
It is. It's really, I was already kind of in the integrative functional passion. But this really helped me focus on where I wanted to go. And that started open up educational experiences with toxicity and immunity, which is really one of the big parts of my practice. Mm-hmm.
So when I think about functional medicine, I think traditional medicine is, and we talked about this a little earlier,
right?
Writing a prescription, masking the symptoms, making you feel better at the time. Mm-hmm. But it's not really fixing the problem. And then functional medicine actually gets down to the root cause to try to fix that. So then everything goes away. Not just the symptoms, but the whatever's ailing you as well. Is that right?
Absolutely. So functional medicine is looking a little bit deeper, looking at the root cause of what is causing the symptoms. Whereas what I was taught in conventional medicine is these are the symptoms. That means it's this diagnosis. That therefore you use this medication to cover up those symptoms, not to treat the problem. Whereas in functional medicine, we say, okay, this is where things are not functioning. These are the tests we would run, and here's how we can start to heal, rather than just covering up symptoms. Mm-hmm. And people get better that way. It's not quick. It's unlike conventional medicine where there's a pill and a prescription and you feel better right away. In functional medicine, honestly, it's a journey. And that's
a journey to wellness.
Well, I think I've heard you say it's a marathon, not a sprint.
Yes.
Right?
Yes. It's a marathon, not a sprint. It's progress, not perfection.
Yes.
So I would imagine in this I want it now, I get it now environment that we all live in, that might be a hard sell for your patients. Now, obviously, if they're miserable enough, they'll say, okay, I'm in for the long haul. But how do you kind of coach patients through that and let them know what to expect?
In different practices do it differently, but I have a phone call with people before they even become my patient.
Wonderful.
And I say, I don't have a magic wand. I don't have a crystal ball. We're in this together. I'm here to coach you and mentor you. And this is going to take time. And I need to make sure that people are committed and motivated, and that they have a support person. Because if everyone in the house or in the kitchen is not on the same page, we're not going to make any progress.
Right, that makes sense. So that brings me to the question of what types of people do you see? What types of issues do you treat?
Right. And again, this is my practice. There's a lot of different kinds of functional medicine providers. But in my practice, we're kind of all over the board. I have families that just want to stay healthy and want to learn healthy lifestyles. I have people who want to maximize their sports performance. And then a lot of what I have is really sick people who have gone to conventional doctors, who have had all the prescriptions, and they're not getting better. And those are the ones I really like working with.
Right.
And those are the long journeys. Those are the marathons.
Right. And you probably feel like you can help them because they have tried so many things that maybe didn't work in the past. Now, you said that you were a conventional doctor, so you went to medical school and did all the years of study that go with that. Did you have to do additional training to specialize in functional medicine?
Yes, because what I'm doing now, I did not learn in medical school.
You don't learn this there.
Yes, I learned all the biochemical processes and then we promptly forgot.
Right.
But yes, I am always learning and doing education and doing research. There are lots of educational opportunities in functional medicine, and there is board certification in functional medicine through the Institute of Functional Medicine.
Okay.
And I'm always taking courses with them as well as other courses.
Awesome.
So how do you go about treating patients? What's the process? Where do you start? How do you figure out what's happening?
Yeah, and
where to go?
Right. History. We have to get a lot of information. And a lot of times it's, not pleasant. It's what do you eat? How do you poop? How do you sleep? What do you do for entertainment? What do you do for yourself? What are your relationships like? What is your spirituality like? So it's a lot of questions. And then we have people come in, we do a physical exam, and then we talk about what kind of tests we need to do. And we can find out a lot about somebody and what's going on in their body from their poop and their pee. So we do that a lot.
Right.
We do blood tests as well.
Okay.
And then we get the test results back where I can find where the dysfunction is. And then we start on the healing journey. And then that's very individualized. It's not one treatment for every person. Sometimes it's a supplement. A lot of times it's a diet change. A lot of times it's talking about sleep and relaxation. But it gets to be very individualized.
Right.
I like the idea of the treating the whole person, that whole approach. So, I went through coursework at the Institute for Integrative Nutrition, and that was one of the things that I really took away from there was your primary foods are not the foods that you put on your plate. Your primary foods are your relationships, your exercise, your spirituality, your career, like your social life. All those things play such a big part. And I love that you look at all of that before you try to treat a person.
Yeah, because I'm what I would consider a healthy person. I don't spend a lot of time visiting physicians, but every time I've been, not once has any of that stuff been asked or talked about. And I'm still reeling from the whole mold in the building. I mean, who would think to ask, how old is your house? How old is the building you work in? All of these things that would never have crossed my mind and was never brought up in conventional practices before.
And that's on our intake paperwork.
Which is fantastic.
And how were you born? That's another huge issue. Were you vaginal or a C-section?
I always wonder why that question is asked. Can you explain that?
Sure. So it just amazes me the way that we were put together and the way that we do function. So the way that we were designed to be born was through the vaginal canal, and we get this big whopping dose of bacteria in our first breath. And that bacteria then settles into our intestines and is our flora. That is where you get your initial gut flora. And babies that are born through C-section unfortunately don't get that big inoculation.
Interesting.
You know, so I was going to ask you about gut health.
I thought about, I'm like, oh, she just led into it.
Yes. Because,
Way to go.
you know, gut, they say your gut is your second brain.
Yes.
And that all disease starts in your gut. So how important is it to have a healthy gut?
It's huge.
And how do you make sure you have a healthy gut?
You poop.
And what if you can't?
Well, yeah.
Let's just get real.
So the gut and the brain, again, how we were designed is really amazing. So when we started out as cells, and cells start dividing and specializing. The cells that are the gut and the brain were the same, and they went in separate directions. And so there's a lot of embryonic similarity between the brain and the gut. And
I don't think I knew that part.
I didn't know that.
Yeah, and they took with it the vagus nerve that connects the
Yes,
brain
okay.
to the heart and to the intestines. And so vagus nerve is something we talk a lot about too. So the cells are similar, and both the gut and the brain have like a saran wrap, a barrier around them, the blood-brain barrier and the intestinal lining or mucosa. And both of them are just one layer of cells. So they're fragile, but they're very important as a way for nutrients and chemicals to cross, to go from the blood to the brain or the gut to the absorption. So very critical, very sensitive. And because the similarity, if there's any disturbance in the gut, it affects the brain. And that's why children with behavioral issues, it's important to look at the gut, especially autism. There's been a lot of evidence that kids with autism and ADHD, you've got to work on the gut first. They were innately born with some challenges with gut health and detoxification.
So I've read about like the red dye number, whatever, and things like that, and really working. So that's the reason why it impacts people with autism more than, I mean, not more than the average person, but why you start with that because of their gut health.
Red dye is more because it's a toxin and an irritant.
Oh, okay.
And along those same lines is glyphosate, which is Roundup, which is unfortunately ubiquitous. It's everywhere. Even in our organic foods, we still have some contamination with Roundup. And Roundup is just mean. So we can consume it and on our foods, and it gets into the gut, and it just like it kills the weeds, it kills the bacteria in our gut. And if we don't have that balance between the good and the bad bacteria, then the cells in the intestine, that one layer of cells that we were talking about, gets to be unhealthy. So the lining of the intestine is supposed to be cells that are tightly zipped together. And when you don't have the good bacteria, when you have glyphosate, when you're eating inflammatory foods, they are no longer tight. They kind of fall apart. And then so imagine your stool's up here and your immune system and your blood is down here. So then every food that you eat can kind of leak down to your immune system. And even if it's asparagus, it comes down to the immune system, and the body says, oh, that's not supposed to be down here. So now every time you eat asparagus, it sets off this inflammatory process.
Oh, is that what leaky gut is?
That's exactly leaky gut. Yeah.
Okay.
So we have to work step by step to, first of all, quit eating those inflammatory foods temporarily, work on healing those cells, make sure that they're healthy again, and telling the immune system to chill out. So that's why it gets to be a journey. And eventually people can bring back some of those foods that they have become sensitive to.
So one thing that I think I'm hearing is that nutrition is really important.
Right. Yeah.
I always say food is medicine.
Absolutely.
And I think that I could be crazy, but I think that you could solve a lot of health issues just by changing the way you eat.
Right. Yes.
So that's true.
So is nutrition and kind of food, I don't know if coaching is the right word, but really educating people on nutrition, is that a large part of a functional medicine practice?
It is. And a lot of functional medicine doctors will have health coaches or dietitians that we work with.
Okay.
But yes, food is medicine, but food can also be poison.
Yes.
And it's not the same food for every person. Some people do fine eating tomatoes, and others, it's a very inflammatory food.
Right.
So it's very personalized as well.
So you mentioned dietitians, you mentioned health coaches. So when you're in functional medicine, do you still either refer or work with conventional type physicians as well if something comes up, or do you find that you're able to handle most of the situations that come along for patients?
No, I still tell people that they need their primary care doctor, or what we call an insurance doctor, because functional medicine is really considered more of a consultant, more of a coach. And so let me just kind of talk about different kinds of functional medicine providers.
Okay.
So someone who practices functional medicine could be a chiropractor, a naturopath, a health coach. They can have lots of different backgrounds. They're not always MDs. And so that's one of the other reasons to continue to have your MD or your primary care doctor.
Oh, interesting. Okay.
I think that would give you an advantage because you are an MD.
Right.
Right.
You kind of see both sides.
Right, but patients need to know if their functional medicine doctor is an NP, a naturopath, who cannot write prescriptions.
Right.
Versus an MD who can, or a chiropractor who cannot write prescriptions.
Mm-hmm. So what do you say to the people that are skeptical? Like, oh, functional doctor, like what does that mean? How much does it cost? Does insurance cover it? Is it real medicine? Like all of those types of things. Like how do you handle people like that and let them know that you can really help them?
Right. And functional medicine is not for everyone. If someone wants a quick fix and is not motivated and not committed to change, then functional medicine is not right for them. So we have to find the right person. And they have to find the right provider for them as well. Because I said some providers do chiropractic adjustments, and for some people that's great. I obviously don't do chiropractic adjustments.
So it's interesting, and I'll admit my ignorance on the whole topic. I thought functional medicine was like a cardiologist or a gastroenterologist, like that was your specialty. I didn't realize it could be any number of naturopath, chiropractor, all the different people that could potentially go into it. You are a medical doctor, so being in functional medicine, is that something that's recognized by the American Medical Association?
So the accrediting organization for cardiologists or gastroenterologists or family practice, there now is a board certification for functional medicine. It's only been within the past couple of years.
Oh wow, okay.
And that board certification is recognized by the AMA, and it's through the Institute of Functional Medicine, but it's fairly new.
Okay. But I would imagine that would lend more credibility to a physician such as yourself that's working in functional medicine.
Right, and it's becoming more recognized and acknowledged. There still is some skepticism from conventional doctors, but there's starting to be more research. So Cleveland Clinic is the leading organization for providing functional medicine, and they've done some studies to help show that this really works.
Yeah.
So
and that's a pretty reputable place.
Right, exactly.
That's pretty impressive.
Yeah. So they took about 1,600 people and they put them on the track for functional medicine, and they compared it to 5,000 of their conventional patients, and they rated them. They had the patients rating their symptoms on a scale, a standardized scale that conventional and functional medicine doctors both use. So they, at 6 months, they compared the two groups and said, okay, now how are your symptoms? And then they compared it to the initial. And 31% of the people in the functional medicine tract had found significant improvement, compared to about 21% of those that had done the traditional treatment. So there is significant improvement.
That's so
and then they did it again
Yes.
at a year. They followed up at a year.
Okay.
And those that were doing the functional medicine continued to improve, whereas those that had done the conventional did not continue to improve.
Interesting.
So my first experience with functional medicine, although at the time I didn't know that that's what it was my dad had cancer and he went to Loma Linda years and years ago. And the program that he was on, it was totally a functional medicine protocol. And he did so well while he was there. He learned so much, but it took me probably, I don't even want to know how many years later, maybe 15 years later, till I even realized that that's what he had done.
And they probably were addressing lifestyle and diet.
Yes.
And not just, here, take this pill.
And movement. Yes, moving your body is big.
Which is such a different experience than what I had with my dad. I mentioned in the intro before you were here that when my father first started to decline, his health was declining, one of the biggest issues he had was difficulty breathing. And his primary care doctor sent him to a pulmonologist, and they ran all the tests and did all the things that they do, and everything came back fine. And so the pulmonologist was kind of like, well, you know, it's not your lungs. Thanks for coming. Good luck, and sent him on his way. And I'm like, but he still can't breathe. You know, how is that okay? So, and we bounced from specialty to specialty trying to find out what the issue was. So, had I known at the time that something like this might be, and it may not have even been an option because it was, 15 years ago, but still, it's such to me, a better way of looking at health is to look at the entire person.
Exactly.
Instead of just the symptoms.
Yeah, you're not just a heart that goes to a cardiologist or lungs that go to a pulmonologist, because those two systems are so connected.
Right.
So looking at the whole body is important.
Is huge. Now, I'll do a little confession here. When Joni said, we're going to interview a functional medicine physician, and I was like, that sounds great. What is that? Because I had no idea.
She did say that.
I did. And then, so I did what everybody does. I Googled. I said, functional medicine. And that was when it was kind of 50-50. Some people were like, this is fantastic. And some people were like, oh, they just run a bunch of tests and it costs a lot of money. And so I went to Joni. I'm like, I don't know about this. But you've talked now about how it's fairly new, that the accreditation is there. So I just wanted to put that out there to say, I was a skeptic. But if you go out and Google, you may find things that make you question. But just remember, this is an evolving field. It's like any other profession. You're going to have different levels of education and different levels of commitment. So how would the average person, if they're now interested in functional medicine, go about finding someone in their area, and what should they look for in terms of training and accreditation and credentialing, all that stuff?
Right. Yeah, and that's a good question. And you're right that it needs to be in your area, because we're licensed and we can only treat people in our licensing area. As an MD,
So you can't do virtually across states or anything like that?
As an MD, and again, remember, there's different levels of functional medicine providers. As an MD, I can only treat people in the state where I'm licensed.
Okay.
Interesting.
Now, naturopaths, there's a lot of restrictions on them as well, that's state to state. So you need to find in your area, and then you need to find someone who specializes in what your issues are.
Right.
You can always Google, functional medicine near me, but I recommend calling them and asking, what is your specialty? What's the training? Can you prescribe? And then a lot of times we'll do phone consults to answer those questions, because there have been times I've talked to people and I'm like, I want to help you, but I'm not the person for you, but I know who might be able to help you.
Right.
So you'll give a referral.
Yeah, or call this person.
Yes. Oh, good. Joey and I always talk about how we're so different.
Right.
So Joey
In
is
a good way.
Well, Joey said, what is functional medicine? I'm going to Google it. I don't know if I believe in it, right? And I'm actually a patient of Dr. Ingram's. I believe
So you
it.
get fair balance right here.
I believe it wholeheartedly. So just quickly, I've had sinus issues, asthma, loss of smell going on 15 years, and just being tired of masking my symptoms. And
Can I just throw in?
Yes.
She also mentioned, as we were sitting here talking, that she used to enjoy a glass of wine as she cooked, and she can't do it because it makes her feel stuffier.
Yes.
So if there's no other motivation, have a glass of wine while you're cooking.
Yes. But I have been seeing Dr. Ingram for a while, and I feel like we are getting a handle on...
It's a journey.
It is
It's
a
a
journey.
journey.
On some of my issues. And the change in the way I eat has been a big one for me. I've had to cut out gluten, And the beer and the wine is big for me because they're fermented, and that really affects me. And I cheat once in a while. And when I cheat, I feel it. I get a headache. I'm stuffed up. The whole next day is bad. My asthma gets worse. Yeah. It's bad. So I'm to the point where I don't even want to cheat anymore.
But hopefully we can find other substitutes. But we're human. I mean, yes. I have people all the time who, and they're, you want to enjoy that glass of wine with a pizza sometime, right. Which has gluten and tomato, and other histamine foods. So good. But you do it, and we deal with it the next day. You just know, okay, I don't have to do something important tomorrow. But we don't want to encourage people to do that all the time.
Yes.
But the point is to learn what your triggers are. Mm-hmm. Yes. And make those decisions.
But I am on a journey, and it is a marathon. But I'm committed. I'm sticking to it. I'm doing it because I just know in my heart and in my gut that I'm going to get better.
And in your gut, because it always starts in
my gut.
So I'm going to guess that Joni is probably the picture-perfect patient for functional medicine.
I don't know.
You have a specific issue that has been, you found the root cause to be mold. You're working on ways to do that. I don't know that I have anything wrong with me. Wrong with me is not the right word. I don't know that I have any illness or underlying symptoms that I need to work on. Would it be beneficial? However, I'm a 48-year-old woman who, Lord knows I'm falling apart everywhere. So would it be prudent for someone like me to seek a functional medicine physician to just kind of get a checkup? Or do you wait until you have something that you feel like needs to be addressed?
No, that's a really good question. Because we want to be preventative. Some people do come just to find out where they are, to find out what their issues are. And a lot of times we look at family history and we say, oh, you have a lot of potential for this. Let's start making some changes. Mm-hmm. And I'm going to use a good example of Alzheimer's disease. So there's some great research by Dr. Dale Bredesen, whose book is The End of Alzheimer's. And you don't know that you're developing dementia until it's too late. Mm-hmm. Same with a lot of other diseases. So, and he is very functional medicine minded. So if you can start making some changes ahead of time, if you have genetics towards Alzheimer's, because there is a gene that can be checked even through LabCorp, through conventional testing, then you really need to start making some of those changes. And it's very simple things like avoiding inflammatory foods such as gluten, making sure you're getting rid of toxins. So that as you age, you're protecting your brain and the rest of your health. But that's just one example. There's a lot of other diseases that we can prevent early on.
Right.
And making sure that your gut is healthy, making sure you have the nutrients, making sure that your bones are staying healthy and you're absorbing all those nutrients that you need for healthy bones. Because once we go through menopause, we start to lose bone.
Right. So it sounds like I could call you, or our viewers could call someone that they see in their area and just say, I'd like to have kind of a baseline, or how would they request that initial consultation?
Again, it's going to be very individualized for what they want, but just saying I want to be as healthy as I can. That's what a lot of people call and ask about. I want to find out if I'm doing everything I should, if I'm eating the way I should.
That sounds like a great way to open every conversation.
Right? Yes. So how can people find you, local people here in Greensboro?
So in North Carolina,
North Carolina,
the whole state of North Carolina, we have a website, Family Functional Medicine, and then people call and we have a 10-minute phone conversation to see if you're a good fit or if I can help you, and then we're ready to move forward. And the other thing I need to tell people is that most functional medicine is not covered by insurance because we spend a lot of time with our patients. In conventional medicine, there's coding that allows us 15 minutes. And in functional medicine, we frequently sit down for 45 minutes. So most, but not all, functional or integrative medicine doctors are out of network. So that means we work for the patient, not the insurance company, and so people pay us directly.
That's good to know.
Sometimes insurance can be filed. Every insurance is different, so you might want to contact your insurance company to see what they will cover.
Okay.
So I would think because insurance companies are so concerned about the bottom line, the studies that showed how patients improve so much better with functional medicine, they would look at that and say, maybe we should start to cover this. Do you think that's something that's on the horizon?
I hope. I certainly hope, because it makes sense to the insurance company. If they keep people healthy now, then they're not paying for hospitalizations and dementia care later on.
Right.
Right. Well, fingers crossed. Let's hope.
Yes.
Because that makes sense.
Is there any,
covered all of our
I was just going to
questions.
say, is there anything that you feel like we haven't touched on that we need to?
I'm sure there is. But
We could talk all day long.
I know. This has
did you get all your questions?
Yes, I think we did. And this has been such a great conversation.
It has.
It
It
has.
really has been. And I will be the first to admit that I have learned so much today. And I won't say that I was negative coming into it, but you have definitely shown me all of the positives and all of the reasons why I hope everyone out there at least looks to see if they have a functional medicine physician in their area that they might be able to get the help that they need.
And thank you for getting this information out there to everyone so they can find their own journey.
Yes.
Exactly.
Thank you so much.
Thank you.
It was so good. I learned so much.
I learned so much, and it's like I said, I came into this as a total skeptic, and now I want to make an appointment and find out everything that I need to know about myself.
I know. You know,
Well, that might be a little much.
Well,
but-
I feel like I needed to have a notebook so I could be like taking notes.
Right.
And I'm, like I said, I'm a patient, and I learned so much.
Yeah, so I hope that everybody else got as much from that as we did, because I feel like we covered not just the definition, but why it's important to look at different options. I mean, I think we've all kind of always grown up and known, well, if you get sick, you go to the doctor.
You go to the doctor, right.
But to think about it from a wellness standpoint, that, well, maybe I'm not sick, or maybe there's something that I do need to know that I could find out because there are resources available to do just that.
Right.
I think it's for me, it seems like it's a real paradigm shift from the conventional way to this way. And I don't know how fast medicine is to react to things like that, but I really hope by having educational things like this that we can start to move into more of that preventative state instead of being so reactionary.
Yes. And when I found Dr. Ingram for my own personal health, I was ready for that.
Right.
I was tired of medicine, and I always kind of go for the natural approach first.
Yeah.
Like if I have a headache, I'm going to put peppermint on my temples rather than take Tylenol. I'm like that type of person.
I take a handful of Advil, not gonna lie.
So, it's just great. I hope more and more people start to utilize this type of medicine.
I do too. And I really feel like, as our title says, authentic wellness, I think this is really authentic to each individual person. I mean, it's not this broad stroke approach to throwing something at everybody and see if it sticks. It really seems like it's so individualized that that's exactly what we're talking about.
Right. I agree.
All right, you did good.
So, hey, our first episode.
I know.
Thank you so much for joining us.
Wait till you see the second one.
Well, we have so much great content to provide. We have 11 more episodes in this season, and we're really, really excited about it.
So keep joining in. It's going to be fun.
Yes.